Okay. My name is Michael, family nurse practitioner, student with United States University. And your initials are TF?
Correct.
And what's your date of birth?
3/1/88.
Okay. Do I have your permission to record this examination so that my instructors and possibly other students may view it?
Yes.
Okay, thank you very much. Today we're going to be conducting an abdominal examination. Do you have any tenderness anywhere right now?
No.
Okay. What I want you to do is go ahead and lie flat on your back for me. Okay, I'm going to expose your abdomen. Okay. So right now, what I'm looking for is symmetry, size, shape, any discolorations, any jaundice, also looking in the whites of the eyes for that as well. I don't notice anything. And you said that you're not having any tenderness right now?
No pain.
Okay. All right, I'm going to go ahead and begin to listen to your abdomen. Okay. So you're going to be listening for bowel sounds across the 4 quadrants. And she has good active bowel sounds. Okay. Right now I'm going to go ahead and listen to some arteries in your abdomen. Okay, so we're going to start off here finding the aortic artery. There it is. And I'm going to flip that over and listen to that with the bell. And I don't hear any bruits. Next we're going to find the renal arteries. So they should be approximately here. There it is. And again with the bell. And following down to the iliac artery. And again with the bell. And finally ending up with the femoral artery, which we would do on skin, not over clothes. And of course I would repeat this on the opposite side of the abdomen. Okay?
Okay.
I'm going to move into some percussion right now. I want to put you in a position though that's going to make your abdominal muscles a little bit more relaxed, okay? So what I want you to do is just bend your knees and put your feet flat up on the table there. Okay, that's perfect. Okay, so I'm going to be tapping on your tummy here, okay? So as we're moving along, we should be hearing areas of resonance or tympany and dullness. The bladder may have either sound depending on the fullness of it. So if the bladder's full of urine, it's going to give a dull sound. If it's empty, it'll give a nice and hollow sound. Okay, so everything sounded good with the percussion. All the dullness is where the dullness was supposed to be. The hollowness is where the hollowness was supposed to be. I'm going to percuss out the size of your liver right now. Okay? And we're doing this at the midclavicular line, so I'm going to go ahead and mark that spot. Then we're going to continue up, going in the intercostal spaces until I hear that dullness again, and then we measure that span. And 6 centimeters is what you got, and that is a normal finding, okay? We're also going to attempt to percuss out the spleen. And I am not able to do so, but that's okay. That is a normal finding, okay? Now I'm going to go ahead and palpate your abdomen, okay? So we're going to start off with just a light palpation. Keep those knees bent, relax those abdominal muscles. Just starting off light palpation in the 4 quadrants. Had she complained of abdominal pain at any one specific location, that would have been where I would have palpated at last. I don't want to initiate any pain or discomfort to elicit guarding or anything like that that's going to interfere with the rest of my examination. Okay, further on, we're going to move into some deep palpation. While I'm doing this, I'm also watching my patient's face in addition to feeling what I'm feeling with my fingertips. Okay, good. Her face is going to give me a clue if I hit any painful spots or not. And I didn't hit any painful spots. She looked pretty relaxed throughout this. And the abdomen was nice, soft, and supple, which is all normal findings, okay? So now we're gonna move on to do some special tests, okay? Gonna test for your gallbladder, okay? It's known as Murphy's sign. All right, so this is gonna give me any indication of inflammation of your gallbladder, okay? So what I want you to do is I'm gonna push down right at that gallbladder. Right there it is, and I want you to take a nice deep breath in for me. And relax. Okay. Positive Murphy's, she would have stopped breathing due to pain at that point of inspiration. That was a negative test. If her abdomen was rounded and I suspected ascites, we could do a fluid shift test. So what I would ask my patient to do is go ahead and place your hand on your abdomen for me, just kind of like a knife hand. Right here, just kind of holding everything in place. And I'm gonna feel over here and I would just give a tap. And if I felt a fluid wave present on the other side, that would be indicative of ascites, okay? Following another special test that I do, you can relax your hand here, is we're going to check for McBurney's point tenderness. So what I do is I palpate, find the anterior superior iliac spine. I'm gonna place my thumb on that. I'm gonna take my pinky and place that on the umbilicus, and I'm gonna drop down that long finger, and that'll put me at approximately McBurney's point. And I'll go ahead and do a deep palpation. She had no pain with the palpation and no pain with the release. So there was no rebound tenderness or no McBurney's point tenderness. We could also do Rovsing's sign, which would be deep palpation on the contralateral side of the appendix. And if it elicits a painful response, that's indicative of appendicitis or peritonitis. Okay, all right. I'm gonna go ahead and pull your shirt back down, have you sit up for me here. And one last thing that we're gonna do, now have you kind of twist your back towards the camera for me, is we're gonna check costovertebral angle tenderness, or CVA tenderness. This would be a sign of any inflammation of the kidneys or kidney stones. So what I do is I just find the end of that rib cage. There it is. I'm just gonna place my hand over here to guard, and just gonna give that a couple taps. And she did not elicit a painful response, so that was a negative test. So, okay, well, that completes my abdominal examination. Thank you very much.
Thank you.